I want to bring in now Mark Kaplan with Sweetser. That's a Maine mental health care provider. And Mark, for those who don't know Sweetser, who aren't familiar with what you guys do, kind of give us a rundown here.
Sure. So Sweetser is a mental health organization that provides services throughout the entire state of Maine. And the services are a wide variety of things. We have residential for adults and children. We have a special school for children who have behavioral issues and can't make it in their public schools. We have outpatient services all over the place. So if somebody needs individual counseling or somebody needs to meet with a psychiatric provider to be evaluated for medicine, we provide that. We also provide crisis services throughout the entire state. So if someone's having a mental health crisis, and I know you've been showing the phone number, and today's an important day to show the phone number. Somebody's having a mental health crisis. If it's not to the point where they need to run right to the emergency room, they can talk with a trained professional crisis clinician.
Can you speak on some of the services that have been dispatched today?
Sure. So in Lewiston, Auburn area, we have a crisis contract there already. Okay? So our teams have been working straight through this this crisis, basically, taking lots of calls, responding to people as quickly as possible. Mm-hmm. We've upstaffed, similar to how you all are upstaffing today to meet the needs of the community, keeping people informed. We've upstaffed as well. Our crisis unit, which is a place people can go to stay for a week, if they're in emotional crisis, we've been open and evaluating people and bringing folks in. We have grief teams too, ready to come in and support people. And we do this with public schools. We're not quite there yet because everything's still shut down.
Right.
But, our hearts go out to anyone who's lost a loved one through this. Anyone. It's unreal, really. So we'll be available for that. We have a special warm line crisis number, but it's called the warm line, and that's for people with mental illness to call and get support. And those phones are manned by individuals who are trained but also have had mental illness.
So you can speak with someone who can maybe better understand,
maybe help better to kind of help someone to bind their anxiety a bit, talk them down, So we're already heavily involved in that community.
Right. You mentioned the public schools. We know that they are closed today.
Yes.
And of course, this is a situation that we haven't had to deal with before, thankfully. But what will sort of the plan look like? Have you talked about that in terms of going into the schools and talking with the kids?
Well, there's planning already underway for that. So when the school, what we're all waiting for is for the perpetrator to get caught, right? All waiting for that, and then people can breathe a sigh of relief. People close to that can go back to school, and then the schools will have guidance staff, social workers, additional people coming in who can, validate and listen, and bottom line is help kids to know that they're safe now, right? And that's what's most important right now.
Mark, I do want to touch on something about, we chatted with you a few hours right here, and an example that stood out to me was, said in interacting with our children, that as a parent, you can, your emotions and your worries can be projected onto them, so kind of check yourself. So I'm curious for parents, people in the media, first responders, teachers who maybe need to check their own emotions through the immediacy of this. 3-4 days from now, when it all catches up to them, what's normal when we start to realize, oh, it's hitting me now. The frenzy's over, but now I'm in the middle of it.
That's very normal. Yeah. In fact, the Maine Association of Psychiatric Physicians had set up a special crisis number for first responders during the first year of COVID. And that's exactly what we saw. People calling 4 or 5 days later, kind of realizing that their mind was, now in turmoil, And so we expect that. I mean, you have hundreds of law enforcement right now out working, just going through the grass, going through the bushes, going through the water, helping to find this guy. And so, our crisis numbers are available for anybody. First responders, law enforcement, newscasters, whoever it is, because we all need it.
Yep.
We all need it. This is a terrifying experience.
I know you've seen an uptick today in the number of people calling
sure.
those numbers, but do you expect an even higher uptick in the coming days as this sort of really starts to sink in for people?
I think it's well, it's an interesting question because I think when the guy is caught, the level of stress is going to go down significantly. Okay. So that's a good thing. But nonetheless, we expect a lot of calls, okay? And we sadly expect calls from people that lost people, that are looking for support and just coping.
And is part of this giving people resources on where
Absolutely.
to go from here?
Absolutely. So we're not just here to talk about the services we provide, but the Center for Grieving Children, for example, is gearing up, doing a lot of good stuff. I mean, everyone's really trying to do their best. This isn't a time when everybody has a chance to dig deeper and provides comfort and support to the citizens in Maine. It's really what's going on right now.
Mark Kaplan with Sweetser, thank you so much again for joining us, and we appreciate you sticking with us through the afternoon.
Sure. I'll be here for quite a while.
Okay, we'll check back in with you as the day goes on.
Okay.
Thank you, Mark.
Pleasure. Thank you.
We, of course, are